Welcome back. It's an important time of year. The annual enrollment period for those on Medicare starts October 15th. Write that date down. This morning we have Mike Berto, healthcare economist and Straight Talk blog author for Blue Cross and Blue Shield of Louisiana. He's here to talk about the key dates people need to know and how they can get some help picking out a plan. Welcome back to the show, Mike.
Thanks so much, Malik. It's really wonderful to be here with you and all your viewers today to talk about Medicare. I mean, this is the time of year when, mom and pop and momo and papa need to really start paying attention to picking out their new healthcare plan.
I completely agree. Now, like I said, open enrollment starts October 15th, but it goes all the way till December, right?
That's right. Today you've noticed that there's a lot more activity on your TV screen, right? People advertising Medicare plans. Open enrollment starts on the 15th and goes all the way till December the 7th. Now, this is a time when, if you've already got a plan, you can change plans. Or if you've never had an MA plan before, a Medicare Advantage plan, you can go ahead and pick one out. You also enroll in Medicare when you age in. So think about it this way. Think about your 65th birthday. The 3 months before and the 3 months after that birthday month are open enrollment for you the first time. And then if you need to make changes, October 15th to December 7th, pretty much every year.
There you go. And then, as you can see, coverage starts January 1st, 2021, which we're all ready for 2021. So, what should people consider when choosing a Medicare plan?
Well, by the time you reach 65, the odds are you have a doc or two you're seeing on a regular basis, probably have a couple of prescriptions that you're picking up regularly. Make absolutely sure the plan that you select covers the docs that you use, that they're in network. Make sure that your prescriptions are 100% covered by the plan so you know exactly what copays you'll be responsible for. And also, I tell people if there's a local hospital that you're the most likely to use in the event of an emergency or if you're going to have surgery, I would want to make absolutely sure that hospital is in the network on the plan that I select.
Very important. And I know this from looking at health myself. It can be very difficult to figure out which one is best for you. You all are doing something at Blue Cross Blue Shield. Y'all doing a series that you're hosting. There's one coming up on November 9th. What are you going to be telling people during this series?
Well, we want to help people to understand Medicare itself. A lot of people don't know this, is three insurance plans, not one. There's Part A and Part B and Part D. They all do something different. We want to make sure people understand that private options like Medicare Advantage can consolidate all of this into one plan and give them an opportunity to simplify their Medicare choices. We are going to have live Facebook show on November the 9th called Medicare Made Easy. It'll be, I'll host it, but I'll have an expert on Medicare there, and you can ask questions live and reach out to us. It'll be November 9th at 10:30. It'll be very informative, and you'll still have a whole month to make your selection after that.
Can't wait. And now let's pivot from people who are looking for Medicare. Everyone needs to make sure they try to have some type of healthcare coverage. For people who are looking for just a 2021 healthcare plan in general, what is some advice you have for them?
Well, unfortunately, we've seen a lot of people lose their employer-based healthcare coverage this year, a lot of furloughs and layoffs due to COVID and low oil prices. The healthcare.gov marketplace is online every day of the year, but the open enrollment, where you can go in there and pick out a plan for any reason, starts on November 1st and ends on December 15th. So you've only got about a 6-week window to pick out a plan on healthcare.gov. Same thing applies. Make sure your docs are in the network. Make sure your hospital's in the network. Make sure it covers the drugs that you want to cover. When you go to healthcare.gov and apply, if you're eligible for the state's expanded Medicaid program, which is free health insurance, by the way, healthcare.gov will let you know that you're eligible for Medicaid.
And again, this is not just for people who are maybe looking at, Medicaid, Medicare. It's really for anyone who needs healthcare coverage, especially during this pandemic. Thank you so much, Mike, for joining us this morning. And hey, last but not least, we want to remind people to get your flu shot. Come on, ladies and gentlemen, to learn more about the options available with Blue Cross and Blue Shield, you can call 800-568-1417 or log on to bcbslaplan.com/Medicare, the website.